Good morning, doctor. I hope you're doing well. To everyone who is viewing our session or will be viewing our session after today, we have with us Dr. Shivshankar Reddy, who will be sharing with us his insights on the topic of depression in elderly. So, doctor, could you please again introduce yourself?
Thank you, Mr. Rogers. I'm Dr. Shivshankar Reddy. I'm a psychiatrist with 8 years of experience in the field. I'm currently practicing at Brain Health Clinic at Kurnool, Andhra Pradesh for last 3 years. So, as you mentioned, we are talking about depression. అంటే మానసిక బాధ బాధ డిప్రెషన్ వృద్ధుల్లో వచ్చే మానసిక బాధ గురించి ఈరోజు మనం చర్చించబోతున్నాం.
Yeah. Thank you so much, doctor, for the introduction. So we'll start with the questions.
Yes.
Okay. So, doctor, the first question to you is what are the common signs and symptoms of depression in elderly?
Yes. Depression in elderly is very common. One of the commonest mental health problem in elderly is depression. So we often talk about depression in young people, how it presents, like sadness, lack of interest, okay, decreased sleep, decreased appetite, okay, they don't want to go to work, they feel very tired, they have pessimistic thoughts, they have suicidal thoughts. Like this, we talk about symptoms of depression in young people. So in elderly also, we do see lot of similarities between young and elderly. However, there are certain differences also are there. One thing notably is that they present as physical symptoms. For example, they feel that their physical health is not well at all, even though it is okay. They feel it's not okay at all. They cut down on the hobbies. Elderly have hobbies of walking, reading newspaper, talking to friends, going to temple, like that. They cut down these hobbies. Okay, they more become homebound. They try to stay at home. They don't go out. They don't become talkative. Okay, they feel they are worried about their constipation. They are worried about their minor physical problems. They keep on visiting the physicians for normal things and decrease in sleep. Suddenly telling that I want to live this life. I've finished everything in this life. Now, for me, I can live this world. So these phrases, these utterances are not attending family functions, not involving in family matters. All these things are indicators that an elderly could be in depression. So these things should be taken seriously. And when we talk about elderly, there's so many things can happen. So we should not assume this is a normal part of aging. So we should never assume that a person not talking elderly is okay is because he's not hearing well, he's not seeing well, he's not talking. We should not assume like that. We should also look at this could be a part of depression. Okay. These are the common symptoms we do see. People attending physicians saying my constipation not relieving, my bowels are not clear, I'm not getting sleep, I have a lot of body aches, my lumbar aches, my cervical pain is there. Sometimes this is the manifestation of depression itself. On probing, on asking clearly, they may say, yes, I'm not feeling well, I'm not feeling in good mood, I'm feeling weak, my mood is not better, I'm getting some negative thoughts. So these things they come up with when you all inquire about it. So it is easy to miss depression elderly unless you ask them. So unless you inquire about it, it will not come out. So this is what we want to tell our viewers.